And we're back with Steve Edmonds of Alliance Insurance Services and Catherine Sevier with AARP. We're answering your Medicare and your health insurance questions. So this is a follow-up to the last segment. Someone's like, why do you even have to sign up for Medicare? Catherine?
Because Medicare is the health care for you after you retire. And Congress has put the regulations in part that are that control how we do that. If you don't, you won't be eligible for health care from the government after you turn 65 and are no longer working.
Right, and you definitely want health care. You definitely don't want to be paying out of pocket for some kind of plan. Right, okay. So, Steve, this person says, since we expanded Medicaid here, do I still need to earn a minimum income to qualify for the Affordable Care Act?
Okay, so a little bit of complication to that question. The Affordable Care Act, a single person has to make around $13,800 per year to qualify for coverage. A married couple probably in the 18 to 19,000 range joint income to qualify for the Affordable Care Act. The Medicaid part of that question, that is the good news. Help is on the way. So if you're making lower income levels than what I just mentioned, under 13,800 for a single person, under 18,000 for a married couple, there has been Medicaid expansion in North Carolina recently passed in the last few months. Unfortunately, we haven't seen a lot of meat as far as when is that going to start? How's it going to be implemented? And this kind of thing. So I'm not sure what the income guidelines are going to be on the Medicaid thing because I just frankly haven't seen it in writing yet. But it is on the way.
Okay, it is on the way. All right, this person is asking, I'm currently on my husband's employer's insurance, but I have been put on disability. Do I have to sign up for Medicare? Catherine?
Yes, absolutely. It depends on where your disability is coming from. If you've already been approved for disability, you will have it until your 65th birthday, and then there is the transition to Medicare. But some people receive their disability from their employer. So if you are not receiving it through at what we call Social Security disability, then you have to apply there separately from getting disability from your employer.
All right, this person's asking about Medicare Advantage. Does it cover meds like Humira, Cosentyx, and Talk, they wrote?
Yeah, I mean, many of the plans will. You can't give a blanket answer to that because with each and every plan, you have to check the drug formulary to make sure what drugs are covered. But I would say that a vast majority of these Medicare Advantage plans would cover most of the drugs mentioned there. But again, you need to check your formulary to make sure.
And when we get into open season in the fall, we will remind you to look at the formulary of the plan that you're thinking about selecting so that you know if your drugs are covered.
So if they want to check right now, do they just go online and the formulary is online for them?
Yes, you can. If you already have a Medicare Advantage plan, you can go online to that particular carrier, and they will have a drug formulary published online. And a lot of times, carriers mail booklets out during open enrollment season that will also have drug formularies in those booklets. So it might be something that they got in the fall that they don't even realize that they have on hand.
Okay, gotcha.
And there's no harm in asking your provider when they're putting you on a new medication, is it covered by the formulary? And they should be able to tell you, yes, this will be covered by your plan.
Yes, and be willing to ask them. It is okay to ask them to look that up for you for sure.
For sure.
Okay, this person says, I still work and my company insurance, I think, has opted out of Part B at this time, but how can I be sure?
The most important thing that you can do is go to your HR department at your employer and ask them the question of, is their plan a Medicare does it meet the criteria for Medicare Part B? They should be able to tell you there are some very strict rules about which plans can be covered or where you can waive and others that can't. So you need to make sure through your HR department that they can assure you of that, yay or nay. And if not, then you need to sign up.
Okay. This is asking about the family glitch. It says, does the family glitch apply if my husband is retired on my state health plan? Should I remove him from my plan when he turns 65?
Yeah, I mean, the family glitch should apply to any health plan, and that would include state employees. So yes, it would definitely apply for
Okay.
sure.